What is Steve Gleason's prognosis with ALS? If you're curious about Steve Gleason, the former New Orleans Saints safety, and his journey with ALS, you're in the right place. Let's break down what we know about his prognosis. Steve Gleason was diagnosed with amyotrophic lateral sclerosis, or ALS, in 2011 at the age of 34. ALS is a progressive and usually fatal neurodegenerative disease that affects nerve cells in the brain and spinal cord, leading to the loss of muscle control. One of the key factors in determining the prognosis for someone with ALS is the age at symptom onset. Generally, younger patients tend to have a slower progression of the disease. Since Gleason was diagnosed relatively young, this could be a positive factor for him. Another important factor is the site of onset. ALS can start in different parts of the body, such as the bulbar area, which affects speech and swallowing, or the limbs. Limb onset, which is what Gleason has, typically results in a slower progression compared to bulbar onset. The delay from symptom onset to diagnosis also plays a role. A longer delay can sometimes indicate a slower progression of the disease. However, specific details about Gleason's delay from symptom onset to diagnosis are not widely available. Treatment with Riluzole, a medication that can slow down the progression of ALS, is another factor. Gleason has likely been using this medication as it is a common treatment for ALS patients. Riluzole may have a greater effect in younger patients and those with a longer delay to diagnosis. Non-invasive ventilation, NIV, is also crucial for patients with ALS, especially as the disease progresses to respiratory muscle involvement. Gleason uses a ventilator to breathe, which is a common necessity for many ALS patients as the disease advances. The use of NIV can significantly lower mortality rates after respiratory muscle involvement. Despite these factors, ALS is a highly variable disease, and survival times can range from a few months to over 10 years. Gleason has already surpassed the typical life expectancy for someone diagnosed with ALS, having lived with the disease for over 13 years. This is a testament to his resilience and the support he receives from his family and medical team. In summary, while Gleason's prognosis is influenced by several positive factors, such as his younger age at diagnosis and the use of treatments like Riluzole and NIV, the progression of ALS is inherently unpredictable. His determination and the support from his community have significantly contributed to his ability to live with the disease for an extended period.